I'm always a person that if I see something that I don't think is right, back in the day I used to be quiet and shy, unless it was something that I felt like somebody was being taken advantage of. And that's when I start to get strong. I did have union representation from where I was working, but they weren't able to answer my questions. And so I thought, why don't I just get involved myself, and then I'll actually know. I'll be happy to share it with other people, but I need to hear it sort of for myself and see how I feel about it, not necessarily somebody that's in a completely different situation than me, how they might be feeling about it.
Okay. So, coming up into that period of union responsibility, did you or your unit or department engage in any other solidarity activities? That, was anybody else laid off because of the rollback?
Yes, definitely.
Did anybody suffer wage or shift differential? Or?
So for us, it was a little different at SNA, because I think in UNA at that time, it was like a bump after a bump after a bump. SNA didn't become part of UNA till 97. Okay. So back in those days, layoffs could only happen if you had less than 2,000 hours, and there wasn't that consistent, there wasn't that bumping that just kept on happening with SNA, because they had things, they were just a little bit different. So I did see people, but everybody seemed to find some kind of work. There were some vacant positions that were available. Perhaps they weren't working where they would necessarily want to work, but they did have a job. And they had a job that was locked in that did provide them with benefits as well.
So when Staff Nurses Association rolled into, did you find, did the conditions roll over with you? That you said you had more security in SNA?
The bumping was just done a little bit differently. It wasn't as much chaos, because again, if I'm an advocate for a patient, how good is it that if I bump that nurse just as she learns that job, somebody else bumps her, so that you never have somebody that actually knows that type of patient on the unit. We didn't have that happening quite so much, so it wasn't as, I don't think it was as devastating for us as it might have been if I'd been working at a different hospital, perhaps. 2000s now, I'm working in the community. It's not so bad. The hospitals are not yet trying to, as soon as you, although we're looking at people when they come in the door, now it's like, how fast can we get them out? That has really changed. When I started nursing, if you were having brain surgery, you came in the day before and we did stuff. Now you go to a day clinic somewhere and they do all your pre-op work, and you come in the day of your surgery, and then it's quick, let's get you out. And that's gradually happened more through the 2000s. People are sicker, they're so sick now. And because there's that push to get them out, they're going back to the community, and those people working in the community, they've got people out there that they don't have the resources to provide the care that those people need. They just don't. So that's what I'm seeing more of. I'm hearing more speaking about how we are patient-centered, and I'm seeing and feeling and living that we are system-oriented. We're telling you that we're doing this for you, but you can't do that because our system doesn't allow it. So I'm finding that really frustrating. We're not working for our clients at all. So in my role as transitioning people, if you kept them for 1 or 2 more days, we would have success when they get home. But no, I understand the emerge is full of people that need to come up, but we send this person home, they fail, and guess what? They just come back through the system again. So I'm seeing a lot more repeat customers, and repeat customers within 24 hours. My own personal belief about how that's happening is, I say higher up. I don't know where this information is coming down, but I believe these managers are being pressured themselves. I don't know why anyone would want that, because they've got it. I think they're being directed from above, from beside, and then they've got all their nurses underneath them.
You said managers, nurses too.
Yeah, everybody's coming at them, so they have to do things in a certain way. When I was still working, I had a director who, myself and the other educator, she was East Indian. This is something that really bothered me. We were pulled into our office, and my work partner was told, you need to pay attention to past and present tense. And Ruth, it's your job to read everything she does out loud and make sure that it's grammatically correct. So there was always this micromanaging, but like you're an idiot micromanaging. It just kept coming. In that case, it was from a director, but I know at least 4 of us actually, 5 left. 2 are not even in nursing anymore because of the way that we were treated. Being micromanaged, having things done behind your back. So for example, my manager was a black lady, and I kind of embraced her. Everything that she did that she sent to the director was sent back to another manager that was sitting in an office with her, where it was worked over and then sent back to the director and then sent back to my manager, thinking that no one else had seen it. And so I every so often would pull her in and say, hey, you know you're being watched and all this stuff is happening. And she'd be like, don't tell me this, don't tell me this. And I'd be like, just follow this chain. You sent this to the director. Director didn't even look at it. So the person that's sitting in your office is spying on you for the director, changes everything, sends it back to the director, and then it comes back to you. But it's happening right in your office and you're not even aware of it. As it turns out, both of those managers ended up leaving, and both of those managers are no longer working for Alberta Health Services. I left because I was always being treated like an idiot. Sometimes things I would write would be corrected. The wording would be all changed. I'd send it back and then it would be all changed again. It'd be like, I don't think that they recognized that they had already trashed my work, but they are now trashing their own work. And it's like, are you doing this just for the sake of no matter what I send in, that's what's going to happen? And you do that to everyone. You need to, if you're going to have people working for you or under you, you need to trust the work that they do and not micromanage it. And maybe if you have a concern about it, you would share it with that person, not go behind their back and show it to other people. So there's no trust in that leadership, or that the decisions that they're making necessarily even come from themselves, that there's a sense that someone else is directing them to do this. And I say that because historically, managers all worked in a certain way, and now they're all working in a different way, and that way is that micromanagement piece of knowing everything that's going on. And so it's unfortunate that we're leaving at the lower levels, but even the middle management, I think that they're getting the same kind of pressure, and I don't know exactly where it's coming from, and this is where I think politics ties into it somehow. I really do. So for example, we're offering you nurses a 3% rollback. Now there's a federal election. Nobody likes Kenny. We would like a conservative federal election, so I just feel like Mr. O'Toole talked to Mr. Kenny and said, you need to change that with your nurses because it's painting a bad picture on all of us. And this is the part where you can't be apolitical. You can't, because even when you look at COVID, it's healthcare, but yet somehow politics is playing a huger or a bigger role in what's going on. So you can see I'm getting hot, sorry. Yeah. Yeah.
You're minor compared to most people.
Oh, am I? Okay. Okay.
No, that's kind of where I was going, is to try and talk about the system has become so dysfunctional that people are just saying,
forget it. And I'm hearing it more and more. I'm not going to be a nurse anymore. And what we all want and we all don't get is an exit interview. You want to know why I left? You probably don't, but I would like to tell you anyway.